Hello and welcome to OffBlueMedical. Today we're going to be discussing some similar sounding concepts for the USMLE. So the first one is when you see the word trousseau. So this has two very different things or concepts. It's involved in two different concepts. First off, it's the trousseau sign of malignancy. It's also called trousseau syndrome. You should not mess this up. This is basically a migratory superficial thrombophlebitis, so it's basically inflammation of the veins. That's superficial, it comes and goes away in different parts of the body. So maybe it comes on the right arm, then the left arm, then the right leg, then maybe the right arm again. So it's basically migratory and is a recurrent superficial thrombophlebitis. And when you see this, for the USMLE, what you should think of is an underlying adenocarcinoma, most commonly pancreatic adenocarcinoma. This is the trousseau sign of malignancy. It's also called the trousseau syndrome. We have a very different concept, which is called the trousseau sign of latent tetany. And this is seen in hypocalcemia. This is basically spasm of the wrist after inflating the blood cuff for 3 minutes. We also have the Schwostek sign, where when we tap on the cheek, you also get spasm. This is also seen in hypocalcemia, but I'm talking about the trousseau sign of latent tetany here. We also have the word Courvoisier sign. Okay, this is painless jaundice accompanied by a palpable and enlarged gallbladder. Basically, this means that there is a pancreatic head cancer. Okay, so it suggests that the bile duct is blocked by something other than gallstones. And as we said, most commonly it's the pancreatic head cancer. Okay, because the gallstones are going to cause the gallbladder to become scarred and shrunken rather than stretched out. So here, in this case, it's going to be pancreatic head cancer. So basically, when you see jaundice, painless jaundice with a palpable and enlarged gallbladder, first thing you think of is Courvoisier sign, and this is going to be pancreatic head cancer. And then you see the word Charcot, and you're going to see this everywhere. Okay, in the GIT system, you see it as Charcot triad, which is cholangitis. Okay, this is the triad. Okay, fever, jaundice, and abdominal pain. Okay, it doesn't have to be right upper quadrant pain. It's classically taught in textbooks as right upper quadrant pain, but they could bring a question up and they could just say abdominal pain and that's it. So you have to know fever, jaundice, and abdominal pain. This is going to indicate acute ascending cholangitis. Okay, sometimes it's also called acute cholangitis. So there's going to be gallstone and biliary obstruction, ischemia, then bacteria is going to migrate and then it's going to cause an inflammation, and this is going to cause the acute cholangitis. It's usually caused by E. coli or other bacteria. And then we have Charcot triad, which is seen in multiple sclerosis. And for this, I made it very easy for you to memorize. Basically memorize this mnemonic, which is can't see, can't walk, can't reach a stalk. So can't see is the nystagmus right here, and can't talk is the dysarthria, the slurred speech you get in Charcot triad in multiple sclerosis. And then we also have can't reach a stalk. So you cannot reach anything. That's the intention tremor. So can't see, can't talk, can't reach a stalk. And then we have the Charcot joint, and this is progressive joint degeneration caused by severe nerve damage, and this is classically seen in diabetic patients or also in tabes dorsalis. Then you see the word Hutchinson. Okay, this is very rare because when we think of Hutchinson, the first thing we're going to think of is the Hutchinson triad, which is the basic classic triad of congenital syphilis syndrome, where you see interstitial keratitis and sensorineural hearing loss and also teeth malformation. Okay, and also Hutchinson incisors and mulberry molars. And this is very classic. When they say Hutchinson, you're going to think of Hutchinson triad. Okay, and for this, how I can memorize this is you can basically draw the face. Okay, let's say that these are the eyes. Okay, and this is the nose. Okay, let's say this is the mouth, and then you have the ears. Okay, Hutchinson triad for me basically say a triangle. Okay, it's interstitial keratitis, so that's the eye. Okay, I'm going to use a different color. Let's use black. It's basically the eye. Okay, the 3 dots. The first one is the eye, interstitial keratitis. Then sensorineural hearing loss. It's going to be located at the ears, and also teeth malformations. which are going to be located around the mouth. So when you connect these together, you're going to get a triangle. So this is going to be the Hutchinson triad, where you see interstitial keratitis, sensorineural hearing loss, and also Hutchinson incisors and mulberry molars. And this is the classic triad of congenital syphilis syndrome. And basically, this is what you're going to see for most of medicine, and then step 1 and step 2 and step 3. But there's also a rare thing called the Hutchinson sign, okay? And this Hutchinson sign is the spread of melanoma to the nail fold from the nail. So just keep that in your mind. Then we have the word Cushing, okay? Cushing, when you think of Cushing, you think of Cushing syndrome or Cushing disease, which is the constellation of signs. You get the moon faces, the buffalo hump, the abdominal stria, osteoporosis, okay? All of these caused by the chronic elevated cortisol levels in the blood, chronic hypercortisolemia. But there's also another thing with Cushing. It's called the Cushing triad, okay? And this is basically in neurosurgery and in neurology. This is the clinical triad of basically bradycardia, bradypnea, and increased blood pressure. So it's basically hypertension, bradycardia, and bradypnea. So this is bradycardia, and then you get irregular respirations, but mostly I see bradypnea, which is a very low respiratory rate, and also hypertension. So this indicates imminent brain herniation. It indicates a dangerously increased intracranial pressure. And this is very important. Then you see the word Paget. And Paget, that word is everywhere in medicine. So we have extramammary Paget disease of the breast, and Paget disease of the bone. This first one, which is going to be extramammary Paget disease, you see this in the vulva. And then we have the Paget disease of the breast, and then of the bone. Of the vulva, this is basically malignant epithelial cells in the epidermis of the vulva. You see erythematous, ulcerated, and itchy skin, and this is going to represent carcinoma in situ, but with no underlying cancer. So if you go and look for an underlying cancer, there's going to be none, even though this is a carcinoma in situ, but there's no other cancer. While Paget disease of the breast, there's always going to be an underlying carcinoma. It's basically the same thing. It's also a malignant epithelial cells found in the epidermis of the nipple, but it always has an underlying carcinoma. So down below, okay, in the vulva, there's going to be no underlying cancer, but above, superiorly, in the breast, there's always going to be an underlying carcinoma because it's superior, so it always has to have something else. So that's how you differentiate between them. Then we have something a little bit different. It's Paget disease of the bone. This is basically where we see an old patient, okay, with headaches, radiculopathies, hearing loss, high output heart failure, okay, and they could have bone pain or they could have none. You send them for labs. Everything looks normal, okay, calcium levels are normal, phosphate levels are, all of them are going to be normal, and then you always only see one elevated laboratory value, and that is an elevated alkaline phosphatase. And this is basically a disease causing disrupted bone remodeling, causing weak, enlarged, and deformed bones. And then we have condyloma lata, that's syphilis, and then we have condyloma acuminata, that's HPV. So condyloma lata are going to be flat and extremely infectious papules that form in moist areas and in mucocutaneous junctions, and as we said, it's caused by secondary syphilis, caused by Treponema pallidum. And then we have condyloma acuminata, which is caused by HPV, most commonly strains 6 and 11, and it causes soft pink cauliflower. And this is very important, cauliflower like papillary lesions. So you have to differentiate. Condyloma lata are flat lesions, while we have the cauliflower like lesions, which are going to be condyloma acuminata. And then we have Berger and Berger disease, two different diseases that sound the same. Berger disease with a E, that's in the renal system. It's basically the IgA nephropathy, which is episodic gross hematuria 1 to 2 days after an upper respiratory infection, okay, such as influenza or a GI infection, okay, such as an infectious diarrhea. And then you see the complement levels, C3, they remain normal. And on biopsy, of course, because it's an IgA nephropathy, you're going to see mesangial IgA deposition. Okay, this is IgA nephropathy, or it's called Berger disease. And then we have Berger disease, okay, with a U, Berger disease. This is also called thromboangiitis obliterans. This is basically a vasculitis, happens in people who smoke. This is a non-atherosclerotic inflammatory vasculitis of the small vessels and also the medium vessels, and this happens in young and heavy smokers under the age of 45, okay, with distal limb ischemia and digital gangrene. So basically the ends of their digits, the ends of their fingers, you're going to see them as black, okay, they have ischemia and then they get gangrene and they can get amputated because they smoke. So this is a vasculitis triggered by smoking, and they get gangrene in the distal parts of their digits. And the definitive treatment here is going to be complete smoking cessation.